हाँ सर आ गए अभी?
हाँ अभी आ गया।
अभी आ गया ना? हाँ ओके सर. So in all these cases we can do better to our patients. In some cases में apart from emergency we can do better. Now the first the main thing is about the homeopathic concept. So इस तरीके से ये न्यू अप्रोच से कहीं हम होम्योपैथी से दूर तो नहीं जा रहे, कहीं हम होम्योपैथी का जो कंसेप्ट है उससे दूर तो नहीं जा रहे. सो दैट इज ऑल्सो वन ऑफ द पॉइंट. मैं ऑडिबल हूँ ना सर?
Yes, sir.
हाँ
Yes,
yes
sir.
ओके
Audible.
ओके ओके. So in these cases we are not going for the straight forward जैसा कि हमने पेशेंट्स का हिस्ट्री लेना है, सोशल, then physical general, then general examination, then systemic examination, then proper repertorization and past history, all these things. इसका थोड़ा अप्रोच अलग है. तो ये अप्रोच इस तरीके का है कि इट इज फर्स्ट थिंग इज पैथोफिजियोलॉजी, then elements from, and then PQRS symptom. So इस तरह ये थ्री कंसेप्ट से हमें इंडिविजुअलाइजेशन तक जाना है. श्योरली वी आर डूइंग इंडिविजुअलाइजेशन. हम लाइक एलोपैथी हम ऐसा नहीं कर रहे कि इसके लिए ये दे दो, इसके लिए ये दे दो. दैट इज नॉट आवर अप्रोच. इंडिविजुअलाइजेशन इज द ओनली अप्रोच. बट इंडिविजुअलाइजेशन जो है वो इंडिविजुअलाइजेशन जैसे कि हम अदर केसेस में मेंटल से करते हैं या फिजिकल जनरल से करते हैं उस तरीके से नहीं करना है. ये थ्री एस्पेक्ट से करना है. तो ये कैसे करना है? तो if suppose the case is any poisoning case is there, so elements from bites is there, elements from burn, elements from shock, all these things are there in repertory. All these things are there in materia medica. Then we can go for the pathophysiology approach, and in that there is a destruction of cells is there. So the irritant poisons, it is say hemorrhagic diathesis is there. So all this it is there in materia medica. Then the PQRS symptoms, atypical symptoms are there like burning, like numbness, all these things. And in physical general, it is there. So with these three things, we can reach to the totality. We can go for the individualization, and by that way, we can treat. The another most important thing is that for the total and complete cure, we have to give constitutional remedy. हाँ. नाउ अगर आपके पास तो जो केस है, सो on these three aspects you can treat it. Surely we can get the totality, but after that we need a constitutional remedy. We have to go for the his life space. We have to take care of the mentals, and we have to take care of the whole this whole life space of the patient. So ये हमें करना है. लेकिन जब पहले पेशेंट आएगा तो हम उसे ये सब चीजें नहीं पूछेंगे. तो उसका मेंटल कंडीशन क्या है, ये वो नहीं पूछेंगे. हम ये अप्रोच करेंगे कि वो एलिमेंट्स फ्रॉम क्या है, पैथोफिजियोलॉजी एक्चुअल पैथोलॉजिकल कंडीशन क्या है, और उसमें क्या PQRS निकलता है, और उससे अटिपिकल क्या निकलता है. सो द माय फर्स्ट स्टार्ट्स विद दिस स्नेक पॉइजनिंग. एम आई ऑडिबल सर?
Continue,
Yes,
sir.
sir. Audible.
Don't worry, sir. You continue.
Okay, okay, thank you. So it is a case of 40 years male, a village farmer head is there, and he is having a snake bite, and he is having severe agonizing pain and gangrene cellulitis and toxemia. See, the case goes to automatically. अगर ये स्नेक बाइट होता है तो हॉस्पिटल, गवर्नमेंट हॉस्पिटल में ही जाएगा. तो वहां पे गया था, लेकिन वहां पे एंटी वेनम नहीं था. That is the one condition. And at the same time, usko thoda, this is not unconscious like that, but that horrifying severe burning pain is there. Then and at the bite is at the right dorsum of the foot, and vomiting hai, acute abdominal pain hai, palpitation hai, swelling, and this is important. The blade and blackish discoloration of right dorsum of foot hai, red discoloration with heat and warmth of the right lower extremity from dorsum up to hip, and lower torso up to subcostal margin. Thirst increased and restlessness due to the pain. These are the things. He is having hypotension, 90/70 mm of HGBP, 102 temperature, 36 per minute respiratory rate, and 130 per minute is the pulse. He is suffering from somewhat breathlessness is there in these cases, and there is a need of oxygenation. एंड इन दैट केस ये वो सब क्रिटिकल केयर में दिया गया है. टॉक्सिक लुक ऑफ on face is there, no petechial ecchymosis is there, and then the main thing is that the gangrene of the entire right foot and the large bleb and extensive disease is there, swelling is there. So this is the main thing, and that swelling reaches to the hip. Now you can see that this is the case, and now I am just I'm talking about the venoms. So three types of venoms are there. You know that there are neurotoxic, hematotoxic, and the myotoxic is there. And neurotoxic, that is cobra, crate. Myotoxic is viper, and hemotoxic is viper, and myotoxic is sea snakes are there. And these are the symptoms. You can see that in the snake bites, breathing difficulty is there. Then if it is viper, in that case, bleeding is there, and at the site of where there is a bite, then there is a large swelling is there, ecchymosis and large swelling is there. So these are the normal symptoms are there. In the hemotoxic, which is different from cobra bite, and vasculotoxic effect, local pain and oozing, local necrosis, pulse is weak, and blood pressure is low. Exactly all the symptoms are matches with this particular case, the hemoglobinuria, and bleeding from natural orifices is there, and intravascular hemolysis is there. Now see, if this is in the rapid pace, and in that cases, this is the totality that bites, snake off, then excessive thirst, restlessness, wound gangrene is there, and poisonous cellulitis is there, and wounds that is black discoloration is there, and septicemia is there. So in these cases, anthracinum in high potency is given, and frequent repetition it is given. Now see, the further remedy that it is seen in this, in the poric, can see the Matra Medica. Here intolerable burning is there, and there in the anthrax particularly, anthracinum it is given, and then the patient as a whole, again we have to see all the things um, in the next follow. So you can see that it is a respected person, then egoistic is there, then he couldn't solve a family dispute. That thing is there, exaggeration, manipulation is there, and then the settled dispute in society, and he feels proud. All the symptoms goes towards the you can see the lachesis, and so this thing we can see that snake bite, egoistic, dominating, contradiction, aggravation, then wounded pride, manipulative, suicidal, irritable, and violent irritability during pains, all these things, and dreams of ghost killing him, and wound gangrenous. So anthracinum, and it has to be followed by lachesis. So this is the main thing which you can see in this. In these cases, you can see at the first it is better with anthracinum, and associated with this. As, I am not saying that fully with the two medicines only the patient is cured. ऐसा नहीं है कि दो मेडिसिन दिए और पेशेंट क्योर हो गया या फिर मिरेकल हो गया, ऐसा नहीं. So all these ancillary measures has to be taken. IV fluid भी लगाया, ऑक्सीजन भी लगाया, but associated with that, the first is anthracinum that has a better result, and the another is wound healing complete without skin graft, and for that lachesis is given 200 C ETCL. So this is the one case, and by this one thing is clear कि इस तरीके का केस भी हम ट्रीट कर सकते हैं. Then the next case is about the scorpion. In the scorpion bite, 32-year-old female, and she brought by her husband. And in that case, they are not knowing that which type of the this ये क्या बाइट हो गया आपके, किसने काटा, कौन सी चीज ने काटा, ये उनको पता नहीं है. एंड देन cases the history is most important. Sir, सुनाई दे रहा है? Hello. Hello.
You continue, sir. Don't worry.
Okay. So at the time of washing utensils, there some burning sensation, and there is a sensation of bite is there, and then after that she ignored that whatever she feels that some anything कुछ लगा होगा, लेकिन उसके बाद में 15 मिनट के बाद में उसे मग भी पकड़ने, she could not hold the mug, and then afterwards the husband is searching, क्या है, तो उसे लगा कि क्या है, तो then he found one scorpion. So that scorpion bite is there, and after this particular this nocturnal creatures are there, and they are hunt at night, and they are aggressive. And in the analysis you can see that from severe local skin reactions are there, and there are 1500 species of scorpion, and out of that 50 are dangerous to human beings. See, ये कोकण एरिया में, महाराष्ट्र में एक ऐसा एरिया है जहाँ पे जो स्कॉर्पियंस है, that is black scorpions, they are only dangerous, and that is the death of a person. Otherwise it is not much more dangerous. And this is the thing is that is they are chemotoxic, neurotoxic, and their venom is more toxic, but as it is in a small quantity, and due to that it is non-fatal. But few are there, few are fatal, but it's their action is most important. That is direct effect on myocardium is there. So this coming to the its treatment, you can see that locally we are given xylocaine injection, देते हैं, calcium gluconate देते हैं, या atropine of for pulmonary edema it is given. And coming to the case again, so in that particular case, the chief complaints of patient was complaining of numbness, and in general examination, tall, well built and well nourished female, no pillar, and see that this pulse is 80, and vitals, the stable vitals 110/80, and local examination, the cyanosis of right hand, and till the wrist, both palmar and dorsal aspect seen before removal of tourniquet, and the swelling of the right index finger is there, no redness and warmth. See, this is the difference in our case and the normal case of the scorpion bite. You can see so many cases of scorpion bite आपने देखा होगा. तो स्कॉर्पियन बाइट में जो पेन है वो इंटॉलरेबल पेन है फॉर 24 hours it is there, and we have to be treated with xylocaine only, and violent burning pain, that is the thing. But in reverse of this, in this particular case, the presenting symptom itself is numbness, and there is a complete loss of sensation to an extent that nerve have lost its capacity to generate the sensation. So this type of the differentiation that we can see in this particular case, and in the totality is alignments from stings is there. You can see that in synthetic repertory it is there, the skin, then stings are there, then anesthesia part is there. In the synthetic repertory in general it is there, then reaction want of, that is synthetic repertory, and seat of action is on a nerve. So that totality is considered, and then this the remedies like apis, arsenic, opium, they are very close, and these are symptoms. But the hydrocyanic acid 1 m in the single dose it is given, and in this particular case the main thing is of the monitoring of the case. Two typical things which you can see in this particular case, इसमें दो चीजें बहुत ही आश्चर्यकारक है. वह एक चीज है कि इसको पेन ही नहीं है, वो नमनेस है, और दूसरी चीज इसकी इसमें ये केस में ये है कि वी हैव टू मॉनिटर द केस. ये पेशेंट्स को मॉनिटर करना पड़ेगा, नहीं तो अगर ऐसे पेशेंट्स को हम ट्रीट भी करते हैं तो भी उसे मॉनिटर करना ही पड़ेगा, क्योंकि ये ईसीजी में कब चेंजेस आ जाए और कब ये बैडली गोइंग टुवर्ड्स हार्ट ब्लॉक, ये कह नहीं सकते. So these two things are most important in this particular case. And hydrocyanic acid, all these symptoms of hydrocyanic acid is there, cyanosis and this thing is there. And see the follow-up, 3 p.m. hydrocyanic acid दे दिया गया है, 4 p.m. complaining of numbness in the middle finger only, then 6 p.m. Numbness in the middle finger, then mild burning pain, and 8 p.m. is no burning pain, and there is no repetition of the dose. And this is the one of the case. So in two cases, means in a snake bite and even in scorpion bite we can treat. Then another thing is another case is there, and uh, am I audible, sir?
Continue, sir, but you have only 18 minutes left.
Okay,
8
okay.
minutes left. Okay, so you can, I think with this case, you continue now.
Okay, okay, sir. Okay, okay. Another case is of this. I'm not going for the details. There are 4-5 cases are there. तो 4-5 केसेस और है, तो इसमें एक चीज है कि एक 65 ईयर्स फीमेल है और इसको पुलिस लाए है, तो ये अपेयरिंग इंटॉक्सिकेटेड और उसको सेंसेस नहीं है और ये हिस्ट्री दे रही है कि ट्रेन ट्रैवलिंग का हिस्ट्री है, इसने कुछ प्रसाद लिया था, इस कोकोनट वाटर कुछ तो उसने लिया है और ये नो मेमोरी, उसको मेमोरी नहीं है, अनकॉन्शियसनेस है और ये ऐसे कंडीशन में पुलिस ने उसको पुलिस हैज ब्रॉट दिस टू द हॉस्पिटल और इसके वाइटल से 100 पर मिनट पल्स है, इसका 100/70 अगेन हाइपोटेंशन पेशेंट है और ये इसमें एक चीज थोड़ा अटिपिकल है, टॉकिंग इन हिंदी लैंग्वेज, डिलीरियस repeated talk and suspicion of being poisoned, hypotonic है, all these things are there. It is a case of datura poisoning and it is a roadside poison, you know that it is a roadside poison and so many cases are there in if it is in UP, in that case it is very common and such type of the things and ये कहीं भी it grows in the west places, so ये easily available है और it can be given in the sweet. So ये रोड पॉइजन है, ये रोड पॉइजन का केस है और जब ये आया है रोड पॉइजन का केस, तो एलिमेंट्स फ्रॉम धतूरा पॉइजनिंग इज एंड अटिपिकल थिंग इज स्पीक्स इन फॉरेन लैंग्वेज. इसको 3 टाइप से इसके देखा गया है. ये देखिए, ये वी कैन सी द ट्रायंगल, ब्रेन, सेंसोरियम एंड नर्व्स इंटॉक्सिकेशन है, their hyperexcitability of higher center and the paralysis of nerve is there, and the third is that speaks in foreign language and repeated talk is there. तो जो फीमेल को हिंदी नहीं आती है वो हिंदी में बात कर रही है, speaks in foreign language, so that is one of the atypical thing, and by this can go for this, and the patient is religious and is a chili, she is chili, and the given remedy is stramonium दिया है. So you can see that they are seeing the things, and stramonium is given and rubric from complete point. So what happens after given stramonium? So alertness again increased, then placidity better, and still intermittent speaking in Hindi, and the time period is 90 minutes. So stramonium, high potency and in repetition, and then she after 4 hours she is asymptomatic. It may be having the 2 effects. One is that the datura poisoning effect is totally vanished, वो भी एक चीज है, और दूसरा चीज ये है कि asymptomatic and the conscious oriented, and time and place and placidity improved, and after that the calcarea carb 200 c single dose इसको दिया है. तो ये another case है. So that case, that this datura poisoning case, that can be treated by this homeopaths. So that is the third case is there. Then the another thing is that you can treat the loperazim, lorazepam poisoning cases. The lorazepam, it is a sedative, and this is the 35 years female is there, and she is brought to the casualty, and she has consumed 8 tablets of lorazepam, and all the things are there. The 120/90 BP is there, and 120 per minute pulse is there, and she has a slow response to oral command. Disorientation is there, and she has vertigo and hypotonic and flaccid and unable to hold the neck. So this is the thing is there. So now, in brief, I am talking about this. Benzodiazepine, and it is a sedative, hypnotic, and the dose is most important. 1 to 4 mg per day. In divided doses, it is given lorazepam, and if it is given in higher, इसको ज़्यादा दिया गया she has taken 8 tablets, 8 to 10 tablets इसने 8 tablets लिए है, and that too of 2 mg, तो 16 mg consume हो गया. This is in front of you. So these are the combinations which can see the alprazolam is there, diazepam is there, lorazepam is there, and then its fatal dose is 5 to 10 grams. And then these are the symptoms: slow breathing, clammy skin, then low blood pressure, enlarged pupil, coma, bluish sleep is there. The most important thing in this case is that she has taken these tablets, and then she approaches after 6 hours. It is not directly approaches or immediately is not approaching, and there is a time period is there. So in the totality, it is narcotics aggravates. The time passes too slowly. The stupefaction is there. A placid tone and the sensorial brain is there. So this is the main totality is there, and the remedy given is nuts moistata. It is given 1000 C. It is given. So in this case, the atypical thing which you can see is here. The She feels she was living 3 months back, and time was not passing fast. So this is the thing which is from which we can go for the totality in this. This time passes too slowly, and stupefaction is there. So by that way, it has to be treated. And then the another case is there. In this case, in follow-up, you can see, and she is able to stand on the feet and the move, and a single dose is given at 3:30 p.m. and 8:30 a.m. on the next day she has discharged. And so this is one case. And the use of high potency in infrequent repetitions, it is important, and the constitutional remedy, that is also important. It is one of the thing. And then another case is of hydrochloric acid poisoning case is there. And hydrochloric acid poisoning, this is one of the interesting cases that it has having two
Dr. Srinivas, now
Hello.
we have to conclude because only 3 minutes is left. So
okay, sir. Okay, sir. Okay.
You can conclude this case in within.
Okay, sir. Okay. So I skip all these things, and we also treated. I am just in one sentence. I said that we are treated this particular case. This is a case of hydrochloric acid, and due to intake of hydrochloric acid, it leads to the cicatrization, and you can see this X-ray where there is a cicatrization is there, and due to that she is not able to eat, and that leads to starvation. So it is a combination, the bad effect of acid, and that leads to starvation. That is the case. And in this, this totality is there: burn, corrosive, then pain, stomach, and the pathology contraction is there. And so causticum is given in this case. And we are also treating electric shock, then electrocution, and Bailey's paralysis, and blast injuries there. So you can see the miraculous results of blast injuries also there. So in conclusion, what I am saying is this slide about this is the miraculous results are there. So conceptual learning is that this is a non-miasmatic illnesses are there, and it is due to the bad effects of the poisoning or electrocution or other things are there, and it is possible that we can treat it with the effectiveness. And the another most important thing is that we have to we must have a knowledge of toxicology is there. For this, particularly those cases we have to treat the poisoning cases. So we must know the knowledge of toxicology, and knowledge of toxicology is important in
thank you, sir. Thank you.
Okay.
Beautiful presentations.
Okay, sir.
मैं लगता है कि आपका ये प्रेजेंटेशन बहुत ही अच्छा है, और आपने डिफरेंट एस्पेक्ट्स में स्नेक बाइटिंग्स का, फिर नार्कोटिक्स का, कई डिफरेंट सोर्सेस में आप बताने का कोशिश किया. एक बात सबसे जो मुझे अच्छा लगा वो यह था कि आपने इसके होम्योपैथिक अप्रोच को इसमें आपने डाला। होम्योपैथिक और खास करके मेंटल सिम्टम्स, इम्पोर्टेंस ऑफ द मेंटल सिम्टम्स, ये बहुत ही महत्वपूर्ण बात है। अगर आप चाहेंगे तो इसका एक सेकंड पार्ट हम लोग सेशन कर लेंगे। मैं आपसे बात करके एक सेकंड पार्ट कर लूंगा, क्योंकि आपके केसेस अभी और है और मुझे जनरली लोग स्नेक बाइटिंग के केस में डर जाते हैं, तो डरने से नहीं, आपने कितना बढ़िया से एंथ्रेसिनम से ठीक कर दिया। फिर उसी तरह से स्कॉर्पियन बाइट्स को मैंने एक केस ठीक किया था, कई एक केस ठीक किया हूँ एपिस मेलिफिका से, 10 इम्पोर्टेंसी से। और भी लेकिन आपने बड़ा अच्छा बताया कि आपके जो पेशेंट है टोटलिटी सिम्टम्स इज मोर इम्पोर्टेंट, is more important. This is the beautiful thing that we have got from you. So congratulations and thank you very much for your very beautiful presentation in this session, sir. So now we are concluding the sessions, and thanks to you, Dr. Srinivas, for your very beautiful presentations. And we expect to have a next session in the from you. Also, I will talk to you and let you know the time. So with this, we conclude this session, because we have our English session has to be started now, and now we are switching over to the English session and handing over the session to Dr. Binduraj. I think Dr. Binduraj, you are here now?
Yes, sir.
Yeah, so you can take over the charge and you can start your session, sir.
Okay, sir.
Thank you, Doctor.